I did my project over the medicinal properties of radium. Radium was discovered accidentally by Marie Curie in 1902 when her and Pierre Curie were trying to understand what X-rays were using an electrometer. Radium is a radioactive substance found in nature. Radium is produced by the radioactive decay of uranium. The intensity of radiation from radioactive materials decreases over time. The time required for the intensity to decrease by 1/2 is referred to as the half-life. The half-life of radium is approximately 1,600 years, according to the NRC year 2019, paragraph 1. Radium's first uses in medicine were kind of diverse and not like how they are anymore. At the beginning of the 20th century, shortly after radium's discovery, it was theorized that radium could potentially cure a wide range of health problems, although radium was never proven to cure anything. Through advertisement, radium was portrayed as an abundant rather than rare mineral rather than chemical, and healthful rather than medicinal. Therefore, radium was used in treating skin ailments like birthmarks and eczema, as well as gout, rheumatism, arthritis, anemia, high blood pressure, low blood pressure, asthma, hay fever, bronchitis, pneumonia, tuberculosis, hemorrhoids, diabetes, multiple sclerosis, insomnia, and even neurasthenia, according to Roschi, 2018, paragraph 2. As a result, companies took this information and put radium into a variety of products that people could use on a daily basis, such as toothpaste, paint, and even people's drinking water. Radium was then temporarily not used in medical aspects for a multitude of reasons. Avid users of the various radium products shortly became sick and even died suddenly, and at first people were baffled because radium was supposed to be a magical cure for anything. It was soon realized that people were starting to develop radium poisoning from the products that they were constantly using. And in an article by a man named Dronsfield, he said, "Last week, Eben Byers died in Manhattan of radium poisoning. 18 months ago, after hundreds of drinks of the radium tonic, he began having pains in his jaw. Severe headaches. Dr. Joseph Manning Steiner, Manhattan X-ray specialist, recognized in Byers' condition symptoms of radium poisoning. Young in years and mentally alert, he could hardly speak. His head was swathed in bandages. He had undergone 2 successive operations in which his whole upper jaw, excepting his 2 front teeth, and all of his lower jaw had been removed. All of the remaining bone tissue of his body was slowly disintegrating, and holes were actually forming in his skull." Dronsfield, 2011, paragraph 33. Radium, again, like I said, was temporarily stopped in medicine, and this basically says that even though people were dying from radium poisoning, companies refused to stop selling the products. This became a huge debate, and the people in America eventually rebelled enough to get companies to stop selling these products. But a perfect example is the Radium Girls, who were all dial printers at a factory which did not warn their workers that radium is a radioactive chemical which can cause bodily damage. The reason it was so poisonous in high quantities is because its radioactive properties can break down the body's tissue. Furthermore, radium is also a significant carcinogen. However, a group of 11 women at one New Jersey factory, 6 were diagnosed with anemia, 8 with leukopenia, 3 with relative lymphocytosis, and 1 with eosinophilia. 5 of the 11 had a combination of 2 or more of these conditions, according to Rossshi 2018, paragraph 4. Now, radium has some current uses in medicine, nowhere near the ones that were used previously. Ironically, even though radium is a carcinogen, radium was later proven to be useful in specific ways to treat certain types of cancers. At first, doctors were worried that these people would see growth of cancer from further exposure to X-ray radiation, but the opposite was soon found to be true. Although radium-223 surely contributes to patients' overall long-term cumulative radiation exposure, no cases of cancer induced by this treatment have been reported in clinical trials, up to 3 years of follow-up, according to Florimenti and Maffioli, 2016, paragraph 34. Doctors must be especially careful when monitoring how much radium radiation a person has been exposed to because of too much radiation. Even with cancer can have negative effects. Patients who had been treated with chemotherapy prior to radium-223 appeared to have poorer baseline characteristics than those who had not. Derevdek et al., 2019, paragraph 15. Some other current uses that I explained here is, why does radiation work to kill cancer? And that is answered in an article by Florimenti and Maffioli, where it says, the high LET of 223Ra results in high biological effectiveness with a cytotoxic effect that is largely independent of dose rate, cell cycle growth phase, and oxygen concentration. And how do doctors use radiation to kill cancer? At first, with the superficial cancers, such as skin cancer, radium would be put directly on the skin to cut out the mass, according to Dronesfield in 2011. The deeper cancers in the organs or bones pose more of a problem, since those areas have been slightly challenging to get access to until very recent times, which basically means that the doctors couldn't necessarily use radium because they couldn't get at the actual cancer tissue. For deeper-seated cancers, inaccessible to X-rays, radium treatment had obvious advantages, such as sources could be placed within body cavities, according to Dronesfield 2011, paragraph 22. Now, what type of cancer is treated using radium? Ra is a bone-seeking calcium analog alpha emitter, which targets increased bone turnover caused by bone metastatic lesions and delivers radiation doses with better biologic effect to more localized area. Etcheber et al., 2017, paragraph 5. Since radium seeks calcium, it is most currently used in treating bone or prostate cancer. This is basically saying that radium naturally goes towards calcium in the human body, and which means, generally speaking, calcium is in bones, so which is why it's used to treat bone cancer. Now, kind of the overall positive and negatives of radium, it has a lot of both in reality, but radium has been both an amazing thing to have been discovered while also being a problematic thing to have been discovered. Radium was problematic because it did cause some avid users of it to die of radium poisoning back in the early 20th century. However, radium has had a lot of amazing improvements in the field of medicine. Without the discovery of radium, people would not have been able to discover X-rays and being able to eventually make modern imaging machines. Also, the only option for cancer would still be hope, pain management, and surgery if radium had not been discovered. We have so much to look forward to in the future of radium. Like, who knows, maybe one day we could eventually figure out how to completely cure cancer using radium. And this concludes my presentation.